Hello everyone, and welcome. In this video, we're going to walk through an important skill for every healthcare assistant. Using the MacVu 360 ECG workstation to perform an accurate electrocardiogram. An ECG is a simple, non-invasive test that records the electrical activity of the heart, providing crucial information for diagnosis. By the end of this session, you'll be confident in operating the machine and ensuring a comfortable experience for your patients. The workstation. It's designed to be user-friendly and efficient. Before we dive into taking an ECG, let's quickly familiarize ourselves with its key components. You have the main screen, where all your patient information and ECG readings will be displayed. Below that, a keyboard for data entry, and crucially, the connection point for your patient cable, which attaches to the electrodes. First things first, power on your workstation. Once it boots up, you'll likely see a login screen. Use your credentials to log in. Safety and data security are paramount. After logging in, you'll want to select New Patient or New ECG from the main menu. This prepares the system to receive data for our current patient. Patient information entry, accuracy is key. Now we need to enter or scan the patient's information. This is extremely important for accurate record keeping and linking the ECG to the correct individual. Always double-check spellings and numbers. You'll typically enter the patient's full name, date of birth, and their unique hospital identification number. Some systems may ask for gender or other relevant details. Take your time here. Accuracy prevents errors later on. Patient preparation, comfort, and conductivity. With the workstation ready, let's prepare our patient. First, always explain the procedure clearly and simply. Reassure them that it's painless and quick. Ensure their privacy and modesty. Ask them to lie down comfortably on the examination couch or bed, ideally flat on their back with arms and legs relaxed. We need good skin contact for the electrodes, so we might need to gently clean the skin with an alcohol wipe if it's oily, sweaty, or has lotions. Sometimes a small amount of hair might need to be carefully trimmed, but always check with the patient first. Electrode placement, the 10-lead ECG. This is the core of taking an ECG, correct electrode placement. We're performing a 10-lead ECG, which means we'll place 10 electrodes, 4 on the torso or limbs and 6 on the chest. Limb or torso leads placement. Placed on the right arm, usually on the shoulder, forearm, or wrist. Placed on the left arm, usually on the shoulder, forearm, or wrist. Neutral electrode on the right leg below the umbilicus. Foot active electrode on the left leg below the umbilicus. Chest leads, C1, C6. These require precise anatomical knowledge. Feel for the angle of Lewis, then count down. C1, fourth intercostal space, right sternal border. C2, fourth intercostal space, left sternal border. C4, fifth intercostal space, midclavicular line. C3, midway between C2 and C4. C5, fifth intercostal space, anterior axillary line. C6, fifth intercostal space, mid-axillary line. Acquiring the ECG, monitoring, and troubleshooting. Once all electrodes are in place and connected, return to the workstation. You'll usually see a Start ECG or Require button. Press it. The machine will now start recording the electrical activity. Watch the screen carefully. You should see clear, consistent waveforms. What if the trace looks noisy or flat? Don't panic. Check all electrode connections. Is anything loose? Is the patient moving or talking? Ask them to stay very still and breathe normally. Sometimes, just gently pressing on an electrode can improve contact. If you're unsure, ask for assistance from a senior colleague. Finalizing and storing the ECG. Once the ECG trace is clear and the machine indicates it's complete, review it briefly on screen. Look for a good quality trace, free from excessive artifact. If you're happy, select Save or Finalize. The Mac VU360 will then store the ECG, usually transmitting it automatically to the patient's electronic record. After saving, carefully remove all electrodes from the patient, dispose of them safely, and help the patient get comfortable. Clean the machine and leads as per your departmental policy. And there you have it. A comprehensive guide to using an ECG workstation and taking an ECG. Remember, practice makes perfect. The more you perform this procedure, the more confident and efficient you'll become. Your role in accurately acquiring these vital readings directly contributes to excellent patient care. Thank you for watching. Check back from time to time for new content.